Hi, everyone. I'm Dr. Lynn Wagner, and this is Doc's Thoughts. So today's episode is about gut health. I haven't talked about gut health for a while, but at Wagner Integrative Health, we take care of people's guts every single day, and we get amazing results. So I think it's important to talk about it. I also think there's a lot of confusion. If you scroll through social media, there will be advertisements for colostrum and collagen and prebiotics and probiotics. And, they all have really, really interesting ideas, and it makes you think you want to buy these products. But first of all, you might not have a gut problem. And second of all, it might not be the right product for you. So you really have to understand, is your gut healthy, and do you need to take something to make it healthy if not? And there's ways that you can do that you don't have to get kind of suckered into all of these advertisements. So in today's episode, I'm going to talk about what the gut is, what it does, why it's important, what symptoms you might have if you have a gut problem, and then give you some action steps to take if you want to start investigating your gut a little bit further, along with some of the things you shouldn't get suckered into doing if you think you have a gut problem, because I think there are a lot of people making money off of people who think that they have a gut problem, and that's also not cool. So why is the gut important? It's really simple. If you think about it, we all eat, and we need that energy from that food to run our body. So think of it like gasoline for a car. So when we eat our food, the gut is responsible for breaking that food down into the things our body needs and then absorbing it into our bloodstream so that it can do what it needs to do. It also is really important for keeping the things out that we don't want to get into our bloodstream. So everything we eat obviously can have toxins. There can be bacteria or different bugs on our food. We ingest things that our body doesn't want. And so it's very good at eliminating or excreting, when it's healthy, those things that we don't need. The gut is also really important for your immune system. The gut is part of your nervous system. There's that gut-brain connection. And obviously with metabolism and craving and hunger, the gut is highly involved with that as well. So it's obviously really, really important. I think we all know that. What are some of the symptoms that you should think about? So if it's like, okay, hey, do I have a gut problem? If you feel great, you have great energy, you're sleeping well, you don't have to worry about it. You don't need to go out, buy all these products and try to protect your gut for something you don't have, because we can get suckered into those things. Is it great to take collagen every day? Probably yes. Is it great to take glutamine every day, which is a great supplement that helps heal leaky gut? It's definitely not going to hurt you. So they're not bad to take, but you don't need to have a cabinet full of supplements if you don't have a gut problem. So just take that into consideration. But a couple things to think about are, your stool consistency. So are you going, not consistency, but regularity? Are you going every day or multiple times a day? So it's really important that we actually eliminate our feces on almost a daily basis. There's obviously a continuum. There are going to be some people who don't go every day, and it might be normal for them. But if you think about it, stool contains toxins, and it's things that we're trying to eliminate. So the more it sits in your body, the more likely you are to absorb things from it that you don't want. So you really want to be eliminating every day. And there's great ways that you can do that are not that expensive and not that hard. You also want to look at the consistency of your stool. So you have to look in the toilet. So ideally you want to have, like we call it, a banana turd. So a nice formed stool that you pass every day, isn't super messy when you wipe, and is not uncomfortable or hard to push out. So if you have something that's really hard or looks like rabbit turds, we call them, that might not be the ideal type of stool for you, and you might need to do something about it, and you might have a problem with your gut. Also, you want to look, is it too loose? Is it falling apart when it gets in the toilet? Do you have chronic diarrhea? Are you going 8 to 10 times a day? On the other extreme, that's also not good. And that's a pretty good sign that you don't have a healthy gut. So you want to look at the consistency. And then you want to think about overall symptoms. So do you have reflux? Are you constantly burping? Do you have a lot of excessive gas? Is it really stinky? Do you have bad breath? Do you feel like you have indigestion? Are there foods you don't tolerate? So do you get really bloated when you eat certain foods, or do you get bloated when you eat everything? Those are all signs that you might not have a healthy gut. And then also obviously nausea and vomiting. That's an obvious one for gut health. The other things to think about that you might have a gut problem, which might not be as intuitive, are things like autoimmune disease. So in our clinic, we see a lot of patients who have autoimmune disease where they might have a problem with their gut. And that explanation I won't go to in this video, but there's a link between gut health, microbiome, and autoimmune disease, which is when your body attacks itself. So if you're running around with an autoimmune disease, you might want to get your gut tested. I see a lot of skin conditions that are rooted in gut imbalance. So things like acne, psoriasis, eczema, even hair and nail changes. Those things can be rooted in the gut, or problems in the gut can contribute to making those things worse. So whenever I have a patient with any type of skin condition, I'm always doing gut testing. I've seen respiratory conditions affected by gut health. So things like asthma or chronic bronchitis. There's definitely a link between your mood and your gut. So in the gut, you make serotonin. And so with a diseased gut or an imbalanced gut, if you have a mood disorder, you want to think about looking at your gut health and making sure that that's optimized. It's obviously not the only cause of a mood disorder, but it definitely can contribute to making it better. Things like brain fog, lack of energy, these are all things to think about that aren't as intuitive, that could be a sign that you don't have a gut that's super healthy. Now let's talk about the anatomy and physiology of the gut, because I think it's important to understand what I'm actually saying when I say the gut, because a lot of people, I had a patient once who I was like, oh, I think you have a gut problem. And she's like, I know, it's so big. I'm so fat there. I'm like, no, I'm not talking about your gut. I'm talking about your gut. So when I talk about the gut, what tell my patients is everything from your mouth to your anus, which is otherwise known as the butthole. And if you think about it, it just runs this nice little track. So it goes mouth, throat or esophagus, stomach, small intestine, large intestine, rectum, and then anus. So if you just think about it like a train track or a path going from the mouth to the anus, that's what I'm talking about when I'm talking about your gut. The other thing I'm talking about when I talk about your gut is actually like the workings, I call it, of the gut, or your physiology. So and that includes a lot of our different systems. So the nervous and endocrine systems are probably the most important part of our gut. It secretes hormones and neurotransmitters that are important for things like digestion, hunger, satiety, your mood, like I already described, and peristalsis, which means the movement of your gut, which facilitates the passage of these things through you. So these things are very, very important in your gut, and we have to consider that when we're thinking about gut health. There's also this thing called the enteric nervous system, which is known as the second brain, which controls your gut independently of your brain. So the gut is literally controlled by something that's not necessarily directly connected to your brain, which I think is absolutely amazing. A lot of us talk about having that gut feeling or that intuition. It feels like it's coming from our gut. And I think there's really something behind that. I think we really need to tap into that when we're trying to make our gut healthy. There's also the immune system in your gut. So there's this thing called the gut-associated lymphoid tissue, otherwise known as GALT. And that is very important for helping you stay free of disease, free of infections. It helps to fight off things. So imagine you have something, you ingest it, and it's bad for you. It's really, really important that immune system is working to keep it from entering your bloodstream and causing disease or infection. So super important. We have to think about the circulatory system when it comes to our gut. So there are blood vessels that, are all within our gut. And what they do is they take the nutrients that we want and they transport them where they need to go. There's also the portal venous system that brings things to the liver where they get processed. And so you can imagine the liver is our major detoxifying organ. And so there's the first step where our gut lining is trying to keep bad things out, but then there's the liver that takes things and it might catch things that actually leak through that weren't supposed to come in. So that is really, really important, a really important part of the gut. And then we have to think about the lymph system too. I just had a lymphatic massage a couple weeks ago, and it just made me think about how little we think of our lymph system. But the lymph system is this system of vessels in our body that just cleanses us and detoxifies us and takes things from where they're not supposed to be and brings them to where they're supposed to be. If you think about swelling and inflammation, the lymph system is like integral to all of that. So with the lymph system in the gut, it actually takes fatty acids and fats into the circulatory system to do what they're supposed to do. So we have to think about the lymph system. And then this is a little bit off the grid, but I like to think of our energy medicine or our energy system. So you've heard of chakras or meridians. I already mentioned things like intuition and the vibe and just having that gut feeling. I think that there's a really huge component of gut health that is tied to that. And I won't go into it too in depth in this episode. I'm going to be getting into that further on down the road. But I think we have to think about our energy and our vibe and our trauma and our stress and how that might be affecting our gut, because I think it might be the most important aspect of gut health. And then you've all heard of the microbiome. So I've talked about the anatomy of the gut. I've talked about the physiology of the gut. And now I'm going to get into a couple little nitty gritty things. The microbiome is a complex community of microorganisms like bacteria, viruses, fungi, and other organisms that reside within your gut. It's absolutely amazing. So when we're born, these things start to grow in us and they fill in our colon, they fill in our nose, our mouth. If you're a woman, your vaginal area, they coat our skin. So like if I take you and I take a scraping of your skin or a swab in your nose or a piece of your stool, I am going to grow microorganisms in a petri dish if I put it on a petri dish. And it sounds disgusting, but these things are absolutely amazing. We need them. You can't live without it. They help protect us. And we are just in the beginning stages of understanding how important the microbiome is for overall health. So I think a lot of things that cause disease that are rooted in the gut are actually from a problem in the microbiome. So I'll talk about that more. There are ways that your microbiome gets disrupted, and I think most of us know this. So obviously, chronic antibiotic use will disrupt your microbiome. The antibiotics in our food sources, I think, definitely disrupt our microbiome. Our lifestyle highly affects our microbiome. So if you eat the standard American diet or tons of sugar, or you have tons of chemicals in your food, that's going to affect the balance of your microbiome. And I would say stress also can affect your microbiome. I won't get into that too much, but all these things come together and they can create the perfect storm where you have an imbalanced microbiome that then can't do what it's supposed to do, which then ultimately can lead to a disease state or you just not feeling the way you're supposed to feel or your best, if that makes sense. And then lastly, there's this thing called the gut lining. So a lot of us hear the word leaky gut, and it's not that complicated. Our gut is lined with this tiny, thin layer of cells, and those cells are super smart, and they know what to bring into our bloodstream, and they know what to keep in our intestines so that we can poop it out. When you get leaky gut, it basically means that those cells have become disrupted. So they're literally like breaking apart. And then there are gaps where things can actually enter into your bloodstream that aren't supposed to. So do I think leaky gut is a big deal? Absolutely, yes. Do I think everyone has leaky gut? No. I think it's a little overplayed, but I think it's something you need to look at and consider and see if you have it. And if you have it, you can treat it. That's the cool part about it. So you can treat it by removing the toxins, removing things that cause it to be leaky. And then there are certain things you can use to actually help try to heal up that lining, which are absolutely amazing. Things that cause leaky gut, things like alcohol consumption can cause leaky gut, microbiome imbalance, a poor diet, toxins, again, stress, lack of blood flow, which is usually more due to an anatomical problem, or if you have, peripheral vascular disease or, clotting in your blood vessels, which is a totally separate topic. And I think that there's a lot to do with trauma and causing leaky gut, which again, I won't get into, but if you think, when I was back in the emergency room, one thing we did with every patient who was admitted to the ICU is we put them on an acid blocker because they always got like micro ulcers in their stomach because the trauma actually caused disruption in their gut lining. So again, trauma, I think, can definitely cause leaky gut. Let's talk about some of the common disease states you might see with a gut problem. So I've talked about symptoms you might experience with a gut problem, but let's talk about the actual diseases. So I look at diseases as things that happen like way down the road. It's kind of like in Western medicine, we're really good at treating disease, but we are not great at like looking at things way before that and preventing it. So once you develop a disease in your gut, it's when the train has been off the tracks for a long time and it has finally developed into a disease. So those are things like irritable bowel disease, like Crohn's or ulcerative colitis. Those are both diseases that are very severe. They cause significant inflammation in the gut. They can cause disability, death. You might need surgery for it. Some people might need very strong medications to reverse this disease. So these are really serious things. And this is why I love GI doctors, gastroenterologists, because they're the ones that help us diagnose these things, treat them if needed. And then I love to actually work with that patient to try to back up that train and kind of get them to the point of where did the train go off the tracks and can we find the root cause and can we reverse their disease or actually just make it better. Then there's obviously things like cancer. So we get colonoscopies or we get the Cologuard screening. That's to look for cancers in the large intestine, which I think is very important that we do. And there's things like anatomical issues. So I have patients who have things called hiatal hernias, which is when part of your stomach actually kind of like herniates up into your chest. So instead of being below the diaphragm, it's above the diaphragm, and that can cause lots of heartburn, fullness in the chest, and things like that. So that's important to know about and usually can only be diagnosed with an endoscopy or a scope. You can have a redundant colon, which means that your large intestine is just really long and redundant, which can make you more prone to constipation. You can have polyps in your colon. So those are all examples of diseases. And another disease that everyone knows about is irritable bowel syndrome. So Crohn's and ulcerative colitis are irritable bowel disease. So those are really pathologic inflammatory disease states that we can actually see when we look at that person's intestines. When you have IBS, irritable bowel syndrome, you have all of these gut symptoms, but there's no known cause. And that is the majority of the patients I see, and they will be 20, 30, 40 years of symptoms. And I am not kidding, where they're taking medications just to calm the symptoms, but they have not figured out the root cause of the disease. And that's where I love integrative medicine, because I think we do a really good job of looking at the microbiome, looking at things like leaky gut, looking at their lifestyle, and trying to figure out why might they have those symptoms, and maybe let's eradicate that irritable bowel syndrome and get it off their plate, which is definitely something you can do. So that's actually really exciting stuff. So how do you know if you need help? So I would say, obviously, if you have any of those gut symptoms, if your stools are inconsistent, if they have weird shape or form, if they're super stinky, if you burp and fart a lot, if you're bloated, if you have food intolerance, like those are really obvious things that you should probably get some help for your gut, and don't just like gut it out. That's funny. But then also, if you're someone who has an autoimmune condition, if you have chronic skin condition, if you have chronic allergies and congestion, I see a lot of patients who actually have a lot of seasonal type allergies, but it's actually rooted in their gut, respiratory issues, mental health issues. Like, it's never a bad idea to look at your gut. You don't always want to do a huge treatment plan on someone if you don't know for sure that it's their gut, but it's never a bad idea just to take a good look at your gut if you have symptoms and see if something's going on. So one of the first things I usually do with my patients is, if their gut symptoms are severe, I have them see a gastroenterologist. So I love having imaging of their gut, whether it's endoscopy, where they look with a camera from the mouth into the stomach, they might do biopsies, or a colonoscopy, where they look from the rectum up and they look at the intestine that way. That will rule out the serious disease, because if you've already gotten to a severe disease state, you're likely going to need medical treatment to reverse that. And there's nothing wrong with that. And there's things we can do after the fact. So I think a GI consultation, GI imaging, there's also ultrasounds and CT scans. So I think Western medicine does a really good job at looking at the anatomy of the gut, which is very, very helpful. And then there's the integrative medicine workup, which obviously is what we do at my clinic. And that's a whole host of things, and it really depends on the patient. So we have what we call functional gut testing. So there's stool analysis. So if you go to a regular doctor and you get a stool analysis, typically they're looking for a bacterial infection, or they're looking for parasites, or they're looking for white blood cells, or blood in the stool. And that stuff is very important. When you do functional stool testing, you're actually looking at a snapshot of the microbiome. You're looking for markers of digestive enzymes. You're looking for markers of inflammation. You're looking for how abundant are there good microorganisms, and is there any sign of overgrowth, which is when some of the bacteria in your gut actually kind of overgrow and crowd out the good ones. I'll give an example of that. So if you've heard of anything like C. diff, that's an infection where someone has this bacteria in their stool, which can be found in a normal person's stool, but it has literally overgrown and crowded out all the good guys. And it's created a very bad disease state with diarrhea, inflammation. It can cause really severe disability or death. So that's an example of overgrowth. So stool analysis from a functional or integrative standpoint, I think is very, very powerful. Is it perfect? Absolutely not. Since I started doing stool testing, which was probably about 6-7 years ago, the companies have changed. They're adding more to it. They're taking things away. As the science on the microbiome and leaky gut and gut health grows, as it definitely is, we're getting better at this. But we're to the point now where I can do a stool test, and I know if I need to put patients on digestive enzymes. I know if I need to put them on herbs to try to suppress some of the overgrowth. I know if I need to add probiotics and prebiotics because they don't have healthy abundancy. So it's very, very powerful. And it's not just theoretical. Like, I actually see positive results in patients, which is why we continue to use stool testing. It's one of those areas where GI doctors, I think, probably roll their eyes at us, which is totally fine. Everyone's been rolling their eyes at me for over 10 years now. But I definitely see a result with my patients when we do stool testing, and then a treatment based on their stool test. So that's a very cool test. You do have to take a kit home and poop into a little French fry tray and send it off. So it's a disgusting test to collect, but it's very, very useful. The other thing we do very, very commonly is called SIBO testing. So SIBO stands for small intestinal bacterial overgrowth. Most of your microbiome you're going to want in your large intestine, but for various reasons, which I won't go into today, that microbiome can kind of overgrow and grow up into your small intestine. And if you think about it, the small intestine is a very small caliber organ compared to the large intestine. So it's just more narrow. So if you have all these bacteria and they're living organisms and they're letting off gas and you're feeding them sugar and then they're letting off more gas, you're going to get bloated and full, and you're going to burp a lot, and you're going to have sensitivities to food. Certain foods are going to make you bloat. And so We love to test our patients for SIBO because there are great ways to eradicate it where you can actually kill off those bacteria and kind of like clean out that overgrowth and then work on rebuilding a healthy microbiome and work on that patient's stomach acid and their digestive enzymes so that they don't regrow that SIBO that they had when they first started. SIBO is very complicated. It can recur. That's a very evolving field, but it's very good to actually test to see if you have it, and then you can at least be educated and know you have it and kind of start from there working forward. And then there's food sensitivity testing. Like every patient asks me about food sensitivity testing. Do I order it and use it? Yes, I do. Do I get annoyed by other practitioners who order a food sensitivity test on their patient every 3 months, and that's how they drive their entire treatment plan? Yes, I do. So what food sensitivity testing is you give a small blood sample. Usually you poke your finger and drip it onto a card. And then the company that you mail it to looks for antibodies in your blood against a number of foods. So it can be 30 foods, 50 foods. Our kit, I believe, uses 180 foods. And it's not a food allergy. So if you want to know if you have a food allergy, you need to get IgE tested. And then if you have an allergy to that food, that is a food that you should never eat because it will cause an allergic reaction like hives, mouth swelling, shortness of breath, no go, right? So people who have peanut allergies, that's an IgE food allergy. Food sensitivity is not testing for that. It is looking for these IgG antibodies, which what they say is that if you have high amounts of IgG antibodies, your body isn't tolerating that food. And do I believe in that somewhat? Does it drive my treatment plans? Absolutely not. So sometimes we'll do food sensitivity testing to see, does the patient have like high antibodies against all of the dairy products, high antibodies against all of the gluten products. So I look for categories, I look for trends, or if they do a test and they're sensitive to everything, I know that they're probably leaking stuff into their bloodstream that shouldn't be there. So it's more suggestive that they have leaky gut. And the cool thing about that is instead of just removing the foods and saying, oh, you shouldn't eat those foods, we actually go and heal the gut so that they might actually be able to tolerate those foods in the future. So again, if you're going to a practitioner and you're having a food sensitivity test done every 3 to 6 months, and then they tell you to eat this super restricted diet and that nothing's being done to heal your gut, I think it's a waste of time. And I think that it's not good. I'll just say that. So do I like it? Yes. Is it, just be careful with food sensitivity testing. I think that the stool analysis and the SIBO testing are much more important. And then with integrative workup, it's also really important to get a lifestyle assessment. So we need to know what the patient is eating, how are they exercising, whether it's not enough or are they exercising too much? These hardcore endurance athletes or people who do tons of cardio, that can actually inflame the gut. So we have to do a lifestyle assessment. We have to see how they're sleeping. What is their stress level? What is their trauma history? All of those lifestyle pieces can contribute to the health of your gut and are very, very important. I would say they're foundational when you're actually trying to heal your gut. So super important. And then with an integrative workup, you get to work with more supplements than medications. So as a Western trained doctor, I did not receive any training on supplementation. All of my training on supplementation was done through my integrative medicine fellowship and in continuing education since then. So there's nothing wrong with Western doctors not using supplements for gut health, but I think supplements for gut health are very, very powerful. So with an integrative workup, you're going to get advised on what to use in terms of supplementation. Do you need digestive enzymes? Do you need probiotics? Do you need prebiotics? Do you need more fiber? Do you need immune enhancing products like colostrum or IgG products? Do you need herbal products to try to kill off some of that overgrowth? We also, though, use medication. So I frequently will prescribe things like antibiotics for SIBO. I'll prescribe lactulose, which is something that's really good for constipation. So it's kind of integrative medicine is kind of the best of both worlds where we will use medications if needed for severe states. But we always try to go with the more natural herbal products when necessary. And what I love about us here is I also try to be minimalistic about it because I hate taking a bunch of pills every day. I try to, let's do as little as possible. Let's just live our life and be happy and have fun. But I think that there are some really good supplements that if used judiciously will help you with your symptoms and help give you the healthiest gut possible. So in the end of the day, what's best for you? And, how should you proceed forward with gut health? So I think going back to the question is, do you even have any symptoms? How do you feel? Do you have any of those other things like an autoimmune disease or a skin condition that might suggest that you have a gut problem? If you don't don't even worry about it. Your gut's probably awesome. So I think that's important to know. But if you do have any of those symptoms, you're struggling with IBS or you're struggling with any of those conditions I listed, it's a cost to do gut testing. It's a cost to see an integrative professional like myself. But at the end of the day, I think the cost is way less than 10, 20, 50, 30 years of symptoms and medication management. And I also think that with an imbalanced, unhealthy gut, you're putting yourself at risk for other disease states. So I do think gut health is very, very important. So with that being said, that was a big episode and I talked about a lot of details. If you have any questions, please post them in the comments. We'd love to see you at Wagner Integrative Health and hope you are doing well and have a happy, healthy gut.